When I first meet somebody who is interested in our weight loss program, I like to talk to them about what their goal is for the program and what's a reasonable weight for them to be at. If they're not already a patient here, then the first thing we want to look at is optimizing hormone levels. Many of our patients are already established with us and we've already done that with them.
Okay.
But a brand new patient, I would look at optimizing their hormone levels because we want them to be successful in this weight loss program and give them all the tools they need to be successful.
Okay.
And one part of that is making sure their hormones are optimized.
Okay, so the hormones do play a big factor in weight loss.
They do. The thyroid does over 200 different things in the body, so it's a very busy, very important hormone. It's responsible for our energy level and our metabolic rate, which is how fast we burn calories. We want that working as good as we can, optimized. Okay. And testosterone's a big player as well because it also affects our energy level. It helps us build and maintain our muscle mass. We want our muscle mass, women too, because it helps us look good, but it also helps burn the fat. We want good muscle mass as well.
Okay, so one of the biggest hormones that you are looking at is going to be that testosterone level, is that correct?
Yes, and their thyroid.
There's different things that we face on our weight loss journey now. So tackling the thyroid, understanding where their testosterone levels are. Where would you go next from that?
We need a few more labs just to make sure they're healthy and there's no contraindications to any medication. We do use medication in our weight loss program. It is a medically supervised program, and that's because of the medication that we use. We have two different medications depending on the patient. One of them is semaglutide. Semaglutide is the generic name for Wegovy or Ozempic. And it's a once-a-week shot that you give yourself. The other medication we use is tirzepatide, which is generic for Mounjaro or Zepbound. That medication is a little more expensive because it has a second medication in it, but it can also be very effective depending on the patient. So those are things that we determine, as well as the dose. We start at a low dose because there can be some side effects, usually involving your gastrointestinal system, such as nausea, vomiting, constipation, or diarrhea. By starting at a low dose and gradually increasing the dose, we can minimize those side effects.
Okay. And with the semaglutide, do you have a lot of patients coming in asking for those things or looking for them initially to
Yes.
to lose weight?
Yes, there's been a lot of media attention around these weight loss medications. We've never had medication that can help us lose weight like we do now. We see celebrities promoting it, losing weight on it, and it has become very popular. I caution people about getting it any old place. Some are able to get it from their primary care provider, which is great, but it needs to be in a program where somebody is monitoring them, not just let me just buy it off the internet kind of situation. We use a very reputable compounding pharmacy for our medication who have the strictest and highest standards for quality, and that's important when you're using this medication.
So everything's extremely monitored.
Yes, so everybody will see a provider once a month or every 4 weeks. We work with them in helping them be successful. We have a body composition machine that monitors and tracks their weight loss. It can tell us how much body fat, muscle, and water that they have and how much they're losing. We want to minimize muscle loss. We want to maintain that as best we can through the help of the provider and our nutritionist, who is a big part of this. We help them to make lifestyle and dietary changes so that they can lose the weight and maintain it, and that's important.
Okay. Is this a medication that anyone can take, or does it work better in certain age groups? What has been your experience working with the medication?
It is FDA approved for 18 and older. We don't work with children, but over the age of 18, we can use it. That's some of the things the provider will evaluate, what other comorbidities or medical issues that this patient has, what other medications they're taking to determine if they're a good candidate or not. But by far, most people can be a good candidate if they're overweight or obese.
Okay, wonderful. Have you noticed, as long as they're addressing the hormonal side, what about like older patients who maybe suffered with weight loss for their entire life and never found a solution? How would this work for them?
It works very well for them. Like I said, any age group, including older people. Most of our older people are very active, which is really good to see, because that is part of the program, is getting them moving and changing dietary habits, which we've had our whole life. And that's not easy to do. It depends on how we were raised and how we live. And we have societal and community factors at play as well. I mean, we have fast food restaurants on every corner. We have restaurants that give you a family-sized serving platter worth of food for one meal, and we eat it. It's learning about portion control. The medication helps to decrease your appetite, so you'll eat less food. We learn to eat slower, which is a problem we have as a society as well. We're always in such a big hurry and busy. But we want to eat slower so that our stomach can communicate with our brain that we're full and we know when to stop. With this medication, you're very uncomfortable if you overeat. We want to minimize as well. And slowing down and enjoying your meal is part of it.
That's excellent. In your experience, what have been some of the biggest success stories or patient transformations with semaglutide and the hormone therapy?
Oh, one young woman comes to mind. She's probably about 30 years old and newly married and had about 100 pounds to lose. For most, that is an overwhelming task, but she has been with it every step of the way. She has listened to all the advice that she's had from the provider and from the nutritionist and taken it all to heart. She is currently down 80 pounds. She looks like a completely different woman. She was smart enough to take a before picture and just is a delightful young woman. She is happy. She is active. Her new husband is losing weight because things have changed at their house. I tease her about being our poster child because she has done so well. It is possible. We do have patients that have a lot of weight to lose. So it's really heartwarming to see how well she's doing.
That's wonderful. Before we wrap up, can you talk a little bit about your personal experience in the program?
I am just like everybody else and gained weight after giving birth to 2 children that I never had before pregnancy and never could take it off. It was a combination of being really busy, a single parent who was raising children and working and going to school. It just never happened. I changed the diet. You can ask my children about how hard we worked at eating healthy, and the weight never came off. When menopause came around, managed to put on a little more around the belly. I was not happy about that. When we started this weight loss program, I was resistant for a long time. I had heard about side effects and I didn't want to be nauseated. And I said, oh, I don't know. But I watched a lot of people lose a lot of weight and decided I wanted to give it a try. I'm really, really happy that I did. I've lost 24 pounds, weight that I never could get off by any other means. And I'm really happy about that. It cuts your appetite down. It gives you that signal when you're full. It helps to take away the food chatter, so to speak, and you're not thinking about food all the time anymore. And that's really, really nice. I'm very pleased with the results. At the end of the program, when we hit maintenance, we want to carry away all the new eating habits that we've learned. We also go down on the dose slowly, just like we went up, to wean off of the medication. Some people choose to keep a very small dose when they need it. Many are able to get off the medication completely when they reach their goal. That's nice to see too.
Can you give us just a brief example of maybe somebody in the program of how long that they should see results in transformation, or how long is the program, or is it customized?
That's a good question. A reasonable amount of weight would be about 1 to 2 pounds a week. I caution people to not get discouraged when they reach a plateau, because that happens quite frequently as well. It doesn't mean that we just reach for more medication and increase the dose. It means we take a good look at ourselves and say, maybe I could exercise more often, or do something different, or tighten up my diet some more and take some more of those changes to heart. That's usually enough to get us off the plateau and get us losing again. So, yeah.
Very nice. Is there a time frame? Like, is it 4 months, 3 months, or it just depends on the person?
Everybody's different, and I don't promise a time frame. I had one patient very angry because she didn't lose a great deal of weight in 2 months. You know, she had very unrealistic expectations, and so we had to straighten all that out. It's not uncommon to be on it for many months to get rid of the amount of weight that they want to lose.
Yeah, and it seems to me from what you said, it's going through a lifestyle change along with the medication and relearning to let go of old habits and accepting new habits.
Exactly. That's hard to do.
Yeah.
Yeah, you have to put in the work. The medication is a tool and it is helpful, but you're going to be doing the work of any weight loss.
Thank you for sharing. I
Thank
do
you.
appreciate you for taking the time. That was wonderful.